All right, Dr. McDonald, thank you again for joining me today. We've seen some of the numbers here. Flu cases are getting to a pretty concerning level at this point. And it's a very, very busy time of year. People are coming off of the holidays, whether it's Christmas, Hanukkah, but now we're coming up on New Year's. I want to start with previous gatherings. Are you at all concerned that maybe there'll be a surge in flu cases from people, say, just coming back home this past weekend?
Yeah, we might see that. In other words, we did just all gather for the holiday season and we're still gathering, right? And so when we get together, we spread our love, we spread our cheer, but we also spread our germs. So I do think we're going to see, more cases come. We'll have to wait and see.
Is there any particularly concerning trend with this flu? Is there like a symptom that has maybe stood out or any hospital data that has been particularly alarming, like any that we haven't particularly seen before?
It's the hospitalizations right now that are getting my attention. You know, the week ending December 20th, we reported over 3,600 people in the hospital from the flu in New York State. Why that's important is that was more than the peak of last year. So what we're seeing with this strain of flu is more contagious, more severe disease. Really important to remember, though, it's not too late to get the flu vaccine. One of the things about our flu vaccine numbers, they're about the same as last year. What concerns me about that is the strain so far this year is more severe. We need more people protected. One of the things that concerns me, too, is when I look at who's in the hospital, 40% of the people in the hospital are 75 and older. Really important for our elderly in particular to make sure they're up to date in the flu vaccine. Anyone 65 or older, very high risk, and the very young are very high risk as well. The second highest rate we're seeing in the hospitals are babies.
Yes, and you mentioned hospitalizations, especially the vulnerable and the elderly. I mean, you and I both know not just a few years ago there was a major pandemic, and hospitalizations were at a very, very concerning level. And now we've sort of gotten, it's a few years later, maybe it's post-pandemic fatigue. Who knows? But it seems people are getting lax about COVID. Do you think people are getting lax about flu?
You know, I think right now one of the things that's really important is to ask yourself who you're listening to when you get your health advice. You know, I think one of the things I see after the pandemic is we became too comfortable listening to strangers that said strange things. We should be listening to our doctor, our state health department. We aren't strangers, and we're giving you the objective, honest truth. COVID and flu, the vaccines are available. You can get both at the same time. And although we're not seeing a lot of COVID right now compared to flu, it's still a significant source of illness in New York State. And it's really important for people to remember that you can get both vaccines at the same time and should. If you're not up to date, highly recommend you do that.
Of course. And I wanted to talk a little bit about vaccines for a second too. I mean, there's a couple different ways to get the vaccine. There's obviously everybody knows the shot, but there's also talk about people that get, say, the intranasal shot. Do you recommend one over the other?
Really, most people do get the injection. You can get the nose spray based on your eligibility for that. Really, when you think about the flu vaccine, what I'm more concerned about you is getting it. And pharmacies, doctors' offices, your health centers, they're waiting for you to come in and get the flu vaccine. They're probably available right this minute for you to do that.
Okay. Now say somebody gets the flu. And Is there any particular symptoms New Yorkers should look out for that would distinct it from, say, the cold, allergies, COVID, maybe?
Yeah, when you get the flu, usually it starts with a pretty good fever, significant cough, and you feel achy all over. A lot of people tell me they feel they got run over by a truck. Flu is like that. It's different from a cold. COVID will be a little bit similar to the flu. What's important to remember, though, about flu is you can get treated for that. Although you could just get by with Tylenol and Motrin, if you're someone who's high risk, over 65, young, underlying disease, an antiviral medication like Tamiflu might be a good option for you. The important thing about that is you have to start that medicine within 48 hours. So that means get to your doctor either in person or a telehealth visit so you can access that care as soon as possible.
Okay. You bring up Tamiflu too, and I've heard I've heard some pediatricians here and there, just based off of other sources, say maybe they don't recommend Tamiflu anymore, and they recommend, say, their kids go a different direction. Do you still think Tamiflu is appropriate for flu treatment?
Well, there's really only one drug approved for kids for flu, and that is the Tamiflu. The other drug that's out there, Relenza, just it's a little bit harder to give to kids because you have to inhale it. I mean, really, it gets to be an individual decision. Underscore the importance of getting the vaccine, though. The vaccine may not prevent you from getting the flu, but it will prevent you pretty good at getting in a hospital or passing away. That's really what a flu vaccine does, help you prevent.
Okay. And say there's that New Yorker that, we talk a lot about the importance of the vaccine, of course. What about for that New Yorker that maybe caught the flu a little too late? At what level do we say, okay, let's stay home, just take some over-the-counter drugs like Tamiflu? And at what level, like what kind of symptoms should somebody be admitted to the hospital right away?
Generally, if you're going to be admitted to a hospital, it's because you're having a trouble breathing or you're not able to take enough fluids. One good rule of thumb is if you're having a hard time breathing, sometimes the way you'll see this, you just have a hard time drinking because you can't swallow, or you have a hard time getting a sentence out. Those are signs that you need to go to the emergency department or talk to your doctor as soon as possible.
Okay. And I did want to touch upon, of course, to one last point. New Year's Eve is tomorrow. We know that there's going to be parties. We know that there's going to be mass gatherings all over the place to ring in the new year. What do you have to say to New Yorkers, especially vulnerable New Yorkers, about staying safe?
You know,
What tips do you have to them before they get to that big gathering?
you know, if you're sick, you really shouldn't be going to the party. I hate to be the party pooper, but the bottom line is if you're feeling sick and coughing, we spread our love and cheer at parties, but please don't spread your germs. So really important to remember that if you're not feeling well, you should be staying at home. Shouldn't be going to work either. Really, this is one of those things where when you're sick, it's best to stay at home and just get better.
Okay. And is there anything else that you would like to add in particular that we haven't gone over in this interview?
We're monitoring hospital capacity across New York State very closely. Right now, the hospitals in New York State do have capacity. We're seeing some tightening in the Finger Lakes region, but it's important to know that emergency departments are going to be a little bit busier right now. All the more reason, get yourself up to date in that vaccine. That's really what's going to help keep you healthy.
Okay. Is there a particular resource you recommend beyond, for those that may not know, maybe don't have a primary care provider where they can go to look for places to get a vaccine?
Yeah, pharmacies right now are the best place to go to get your flu vaccine. Sometimes you can make an appointment online, sometimes you can walk in, but pharmacies are really the most convenient place to get a flu vaccine. Most of us live right next to a pharmacy too, by the way. They're all over the state.
Okay. Well, thank you, Dr. McDonald.